Doctor, in the last segment, we had talked about Thermage. Could you compare Thermage to laser?
Well, lasers are wonderful technologies that can be used anywhere from laser hair removal to tightening of the skin. It's great to get rid of pigmented lesions, brown spots, as well as vascular lesions, those red spots, acne, rosacea, that kind of thing. Lasers work a little bit more superficially. It's absorbed by the skin pigments. And then the Thermage is radiofrequency waves, which we've been using for years, such as orthopedic surgeons use it in arthroscopic surgeries, that kind of thing. And it works deeper, and it's a patented thermocool system. If we used a laser to the temperatures required to cause collagen to be stimulated in the deep tissues, you'd actually burn the face.
Let me interrupt you. When you say deeper, what exactly are you referring to?
To the layers of the skin. So you have the superficial, what we call the epidermis, and then you have the deeper level of the skin, which is called the dermis. So the lasers work a little bit more superficially because of what is attracted by the laser energy, unless you're actually inserting it under the skin, such as in the smart lipo procedure we'll talk about in a few minutes.
Is there a point where facial plastic surgery outweighs the treatment of Thermage and laser?
It all depends on when you come to see me. Younger patients are trying to do minimally invasive techniques to maintain their youthful appearance. Older patients come in and sometimes they want the minimally invasive treatment, but that's not going to be successful for them. And that's why I think in the general public that people are not satisfied with some of the treatments because they actually need something further. If you have a brow that's dropping and is actually blocking your vision, or you have an upper lid skin that's blocking your vision, no amount of tightening besides a surgical intervention really is going to get that up. Same thing with a sagging face. In order to define the area, sometimes you just need that surgical intervention to truly do what you want it to do.
Doctor, what would you do to fix my face?
First thing, I would use some Botox to relax this area here, and then see how your brow is descended over. It should be up here at this rim, so I would recommend a brow lift. There's different options. There's an endoscopic brow lift, which is small incision is made up there, or you could have a more extensive brow lift, and what that would do would lift up this tissue here so you can see a little bit better. If you've had the upper lid blepharoplasty, I would also recommend for this excess fat that is pooching out here, a lower lid blepharoplasty. Then I would work my way down. Go ahead and turn your head to the side. You have a little bit of a elevation there. You can either have an invasive rhinoplasty, in which case we could lift the tip up and then get rid of that hump, or not minimally invasive, we could use a filler such as Radiesse, which actually would fill in this area here to even up that surface. Working our way down, I think you said that you were working on some weight loss techniques.
That's what I'm working on.
We could also do smart lipo to get rid of this area here. Another option would be a direct lipectomy where I make an incision here, remove this fat, and then sew together something called the platysma, which is that muscle that keeps all the fat inside there. Thermage is great. It can do a lift for you and define your jawline a little bit more. You also have a little bit of, is this acne scarring? And I could use some fillers in there. And in these nasolabial folds, you don't have too much of a prominence, but we could fill that area as well. Around the area around your eyes, I could use some Botox to flatten out some of those wrinkles, and again, the brow lift would elevate that.
Could you do it in one visit?
After the brow lift, it would take a couple of weeks. If you had a full facelift done, it would probably be about a month. Now, if you had some of the minimally invasive procedures coupled with a brow lift, probably a couple of weeks.
Now, afterwards, after I was healed, you have some cosmetics, don't you, that would probably help my face?
I do, and I believe that that's one of the most important things to maintain yourself.
Let's take a look at one of them right now.